right treatment approach. The fundamental objective of asthma management is to achieve and maintain control for prolonged period. So once patient comes to you, should have relief from asthma, long life or full life. Now gaining optimal asthma control, that is GOAL, GOAL study. So this is the study of 1 year duration. Number of patients involved were 3,421. And what was the aim of the study? Comparing the efficacy and safety of the stepwise increase of salmeterol fluticasone combination with fluticasone alone in achieving two predefined composite measures of asthma control. So in this study, you can see in the slide definition of well controlled and total controlled asthma. Now you can go through the slide. In first half there is well controlled asthma and second half total controlled asthma. To know what is the definition of well controlled asthma and total control of asthma. The components which are included in this are each week symptoms, daytime symptoms, rescue medicine, morning peak expiratory flow, night awakenings, exacerbations, emergency visits and drug related adverse effects. And here we can see the results. Asthma control status at the end of 1 year treatment, and here is the well controlled asthma and total control asthma. The APIM survey showed that 0% patients in India achieved guideline defined asthma control, and as per the GOAL study, 41% patients achieved total control. That means out of 10 asthma patients, only 4 patients achieved total asthma control for a period of 1 year. Second, total control status across all stat of asthmatic patients. Here, you can go through the slide again. Asthma being a chronic disease, GINA defines goal of asthma management as achieve and maintain control. GOAL study hence proved that patients can not only achieve asthma control but maintains it for longer period of time. And third, lower exacerbations with salmeterol fluticasone combination. APIM study, 66% of the asthma patients in India report exacerbations of asthma in the previous year. Patients on salmeterol fluticasone had significantly lower exacerbation in 1 year as compared with fluticasone propionate alone. So lower exacerbations means reduced economic cost burden on patient and better quality of life. Fourth, SFC improves quality of life. Now again, APIM study, 72% Indians report that fear of asthma exacerbations inhibit them from doing things they want to. So here, as we have discussed the psychological aspects of the asthma, this is very, very important. Quality of life is one of the major problems faced by asthma patients, and this survey clearly showed that majority of the patients compromise their quality of life due to fear of asthma attack. And GOAL study proved that with SFC, 61% patients improved their quality of life, and yes, they never had fear of asthma because of these drugs. Nighttime awakening with the SFC decreased very well and increased the productivity, individual productivity by 50% in India. Nighttime awakening is the common symptom of asthma. In India, asthma patients reported 50% decrease in the productivity due to insufficient sleep, inadequate sleep, or low quality sleep. Gold study shown that 31% patients on SFC had zero nighttime awakening during 1 year. So this is very important factor as far as quality of life and long duration asthma control is concerned. Next important factor is 72% symptom free days with SFC. So APM study shown that 78% of the asthma patients in India miss work or school because of the asthma, with the longest leave absenteeism of 16.5 days, as we have seen in previous slides. Now, missing work or school due to asthma is common problem faced by asthma patients, and Gold study shown that patients on SFC for 1 year had 72% symptom free days, that is 262 days out of 365 days lived without any asthma symptoms. 87% rescue medication free days with SFC. Again, this is very important because asthma patients, they get frequent attacks and they need rescue medicines. APAIM study shown that 83% of the Indian asthma patients report using rescue medications for asthma in the previous month, the highest in the Asia Pacific region. And Gold study has proven that with SFC medication, patient rarely used any rescue medication. 87% rescue medicine free days were there, that is 318 days out of 365 days because of the SFC. So that is very important factor. Friends, conclusion is Gold study has proven that patient on SFC had achieved and maintained guideline defined asthma control for a longer period of time.